In surgery.
Surgical uses.
Surgical.
Ma'am, for introduction of drug, administration.
For doing any procedures, for doing any test method, for any treatment purpose, we are using any devices. So a medical device which can be defined that it is a medical tool which does not achieve its primary intended action in human body by any pharmacological or any immunological or any metabolic means by which it can be assisted in its intended function by such means. So it can be an instrument, or it can be any apparatus, or it can be any appliance or any implant material or any article which can be used alone or which can be used in combination, which can be installed with the help of any softwares or an accessory. So these devices, when we are conducting any studies in devices also, same thing which is applicable, like same ethical principles which is applicable here also, same regulatory principles here it is applicable also. And it's important that safety of these medical device data also we have to get it. So before starting these human studies, animal studies also, which must be conducted. So these devices, it can be used for any detection purpose, or it can be used for any diagnosis purpose, for any prevention, for the monitoring, for any treatment purpose, then for any replacement, for the modifications, then for any supporting or sustained life, for the disinfection of medical devices, as a control of consumption. For all these purposes we are using. For any diagnosis, treatment, mitigation, for the prevention, we are using these devices. So it can be used by internally or externally. So can you tell me some example of these devices? Any examples of the devices?
Pacemaker, which is implanted in heart.
Okay.
Catheters.
Catheters. ECG
The stents also.
X-ray machine.
The stents which
Stents. So that we are giving internally, right? Then what is external devices?
the blood sugar glucometer.
BP apparatus, glucometer, weighing machine,
Oximeters.
oximeters, thermometers. Like that, some devices which we are using internally or externally. So, which have more risk? Is it internal devices or external devices which have more risk?
The
Internal ones.
Internal devices. So here is also for these devices, we have to confirm the safety and efficacy of this product. Whatever the devices, we have to confirm the safety, because these internal devices, they have more risk comparing to the external devices. So that also should be checked in that. And in case these devices, it's same like covered drug, it should be provided free of cost. Okay, whatever the study drug which you are providing, that will be provided free of cost. So here the devices also, which should be provided free of cost. But there is a chance that some of them are devices, it's very adverse event happen or any serious adverse event happen, it should be reported within the same timeline. So what is the timeline for the SA reporting?
within 24 hours.
Within 24 hours.
24 hours. Within 24 hours, we'll do the reporting. Then follow-up report.
14 days.
14 days follow-up report. So who is responsible for the reporting of these SA reporting?
Investigator.
The investigator.
Investigator is responsible for the reporting. Okay, so to whom investigator will do the reporting?
The
Sponsor.
EC and to the sponsor.
Ethics committee and
The
regulatory authorities.
And to the regulatory authorities, they will do the reporting. And is it required that we have to get the consent also here in the study? Is it
Pre-consent.
required to get the consent? Consent, is it
Yes.
required to get the consent?
Yes.
Yes.
Yes, here is
Yes.
also it's important that before doing any study related procedures, we have to obtain the consent from the trial subject. Okay, the investigator should get the consent from the trial subject also. So, like this information which is given here in this device trial information. Then after that, next study information which is given in the guideline, it's about biologicals and biosimilars. So biological means the biologic drug means it can be composed of any sugars or any protein, nucleic acid or any complex combination of any substance, which is like living cells or any tissue. So this can be uh, product can be produced by using with or without rDNA technology, recombinant DNA technology. We can create this biological product. So this biologic means it is a substance of any biological origin which can be used as a drug. So here, when you are conducting any studies in the biological substance, here also special care that must be taken for the review of the data generated. So the special expertise should be present for here in the study for the review of the data by which we can be check the risk in these biologics. And here, along with the biologics, some biosimilar studies also we are performing. Biosimilars. Biosimilars means it is also a biological medicinal drug, which is almost same like identical copy of the original product, but it is manufactured by another company. So, like when you are doing any, when you have discovered any product, everyone they will have get an patent, right? Everyone they will get a patent protection for the product. But when this patent expired, okay, when the patent expired, the other company also they can manufacture the same product. Okay, so if any biological product which patent is expired, if any other company which is also manufacturing the same product, then such drug which will be like biosimilar. So in this case also the studies that must be confirmed. Like they have to confirm that this product which is same like our innovative product, like same like our reference product, same like our original product, that needs to be confirmed. So for that biosimilar studies also will be performed. Then next type of study which is like surgical study, surgical intervention, surgery. We will conduct studies in surgery. Okay, so here we are conducting the studies also same like general principles which is applied. Like what is a common thing? In the first slides we discussed about some general principle. Huh? So what does that? What was the principle which we discussed first?
Maximum benefits and minimum risks.
Maximum benefit and minimum risk. Then
Principle of essentiality.
not
Right,
that
safety
principle.
and
Today we discussed about some principle. Huh?
Safety and well-being of the
Right, safety, well-being of the trial subject that should be protected when we are planning, conducting, or reporting the study. Then
privacy and
confidentiality of the subject.
privacy and confidentiality of the subject should be protected.
No harm to the subject.
Do not harm the subject.
Any adverse events should be reported to.
Serious adverse events should be reported. Then clinical trial should be registered.
environmental protection.
Clinical trial should be registered in
CTRI.
CTRI,
Clinical Trial Registry of India.
India. Then clinical trial should be conducted with the approval of
EC.
EC and RA.
EC and regulatory authority. Like that same principle which is applied here is also. Then here in these cases, free treatment, like the free treatment, it should be provided to the trial subject. Provision of the free treatment, that should be provided. Then compensation should be provided. So in which cases we are providing the compensations to the subject or to their nominee?
There is any death or disability.
There is any death or disability happen, we will give the compensation. Okay, so that is because of this intervention, because of this surgery, if any disability happen or if any death happens, we'll give the compensation. So who will give the compensation?
Sponsor.
Sponsor.
Sponsor, they will give the compensation, or the sponsor representative, they will give the compensation. So who will give the order to the sponsor or the representative of the sponsor that you have to give the compensation?
Ethics committee.
Investigator. The ethics committee or the investigator.
No, ethics committee, they will give the opinion, but the final order who will give?
Regulatory authority.
Regulatory
Yes,
authority.
regulatory authority. The regulatory authority, they will order to the sponsor or to the representative of the sponsor that you have to give the compensation. So same here, it's applicable. Then in any protocol, where any established surgical intervention which is to be studied, the researchers, they must provide a references for the procedures and describe about the complications which is involved. There may be some risk which can be happen during that also. So that must be explained also to your subject properly. Then such information should be properly explained, and the EC, they have to review the study and the procedures. Then risk-based assessment also, they have to be checked. Then also, before starting the study, EC, they must review the animal modeling information from the animal study. Whatever the information which is collected with the about this surgery method, that should be collected, which is to provide as a safety evidence that this method which is safe for the doing in the human subjects. And if any adverse events or any serious adverse event happen, it must be reported also to the EC and sponsor. Then also here it is mentioned in the clinical trial that due to ethical issues, due to ethical issues, sham surgery should not be included in the trial design. Sham surgery, SHAM, sham surgery. Do you know what is sham surgery? Due to ethical reason, sham surgery should not be involved in the trial design. What is this sham surgery? Sham surgery. SHAM, sham. Any idea? Due to ethical issues. So what may be this ethical issue? Sham surgery not be included.
Ma'am, what is how can you this thing spell out sham? Sham?
SHAM, sham.
What is that?
That I asked you. Do you know about that? That's my guess. Sham surgery. You hear about placebo?
That course is
So this is about the placebo
sugar.
surgery. Like placebo drug here. So this is about the placebo surgery. Okay. Sham surgery means placebo surgery. Okay. So what is my point, which is mentioned here in the guideline, that in the ICMR guideline, it is mentioned that due to the ethical issues, sham surgery should not be included in the design of the clinical trial where there is a strong scientific reasons. So sham surgery, like in a placebo surgery, fake the surgical intervention should not be involved here in the surgical intervention. Okay, sham surgery, fake the surgery or the placebo surgery should not be involved in the study design due to the ethical issues. Okay, so like that information which is mentioned in the surgical intervention. Then there is an